Who are new here, my name is Dr. Michelle Henney, and I'd like to welcome you to Relevate Sports Medicine's Virtual Journal Club. For additional webinar educational opportunities, you can visit our website and register directly for the webinar, or sign up for the email list to be notified of upcoming webinars. We're continuing to update our schedule, so check back often. This video will be available for review after this journal club. The information contained in the video content represents the views and opinions of the presenters and does not necessarily represent the views or opinions of Relevate Sports Medicine. The mere appearance of video content on the website does not constitute an endorsement by RSM or its affiliates of such video content. The video content has been made available for informational and educational purposes only. The video content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have read or seen on the site. RSM hereby disclaims any and all liability to any party for any direct, indirect, implied, punitive, special, incidental, or other consequential damages arising directly or indirectly from any use of the video content, which is provided as is and without warranties. For athletic trainers who are intending to get live CEUs from the BOC, you will receive an email 1 hour after the webinar concludes, which includes a link to the combined quiz, evaluation, and assessment. You will have up to 72 hours to complete the quiz and the evaluation. This email will come from customercare@gotowebinar.com. Please ensure that this is done to receive your statement of credit. If you don't receive the follow-up email or you have any other concerns, then contact us via our email at journalclub@relevatesportsmedicine.com. Once the statement of credit is available for download from our website, you will receive an email notification. If you have any questions during the webinar, please submit the question and we will review questions at the conclusion of the presentation. If you cannot see the PowerPoint slides and you're accessing the webinar from your mobile phone, swipe the screen to the left or to the right and the slides will become visible. The recording will be available for review from our website tomorrow. Rikki is a registered dietitian and a board-certified specialist in sports dietetics. Oh, you'll have to help me with that. With more than 20 years of experience in the field. She currently works for USOPC and serves as a lead dietitian for USA Track and Field. Before joining Team USA, Rikki spent 7 years as the Director of Performance Nutrition for Orlando City Soccer Club. Her extensive experience also includes roles as a sports dietitian with an NFL Combine training facility at the ESPN WWOS Sports Center, the Oakland Raiders in the NFL, the U.S. Women's National Soccer Team, and Columbus Crew for Major League Soccer. And she's going to speak today about nutrition for injury and recovery. I'll have you take it away.
All right, awesome. All right, I'm going to move this little thing out of the way. All right. So let's see if I could advance. All right, there we go. Okay, so I'm going to go through and Michelle will, in the chat, are there questions that will pop up, or is that kind of how, or we wait to the end?
Yes, I'll let, so as not to kind of interrupt your flow, you'll just kind of talk into your screen. And then if they have any questions as you're going along, then we'll go through those questions at the conclusion. Yeah, at the end.
Okay. Sounds good. Okay. So these are key nutrients that during the ebb and flow of the healing process. This is kind of just more of a standard key nutrient list. And then like everything in everyone's world in sports medicine, it depends. So that's kind of my two favorite words for about anything with nutrition with sports. And so these are kind of the ones that I would kind of go after in regards to what are they doing, what have they been doing, food-wise, supplement-wise, and going. So these are kind of my checklist. A little bit, I'll separate a little bit of the bone and the connective tissue, but I just kind of clump those together. The ones with the asterisk, so say for example, bone, connective tissue, vitamin D, and I am specific to say D3. And that's something to really almost just not assume. Majority of people that go off the shelf to get their supplements, vitamin D3 is probably 80 to 90% going to be a D3. But that would be something just to double check that they inherently maybe picked a D2 Also, my understanding is, I don't think it's changed, but prescription for vitamin D is most likely going to be D2. So we want to go ahead and get the D3. The calcium, I can answer questions about those forms. I do have some more kind of favorite forms. Basically, what is the calcium married to, whether it's citrate, whether it's carbonate, and then vitamin K, but specifically vitamin K2. And then the collagen, I'm going to talk a little bit about collagen with whey and with EGCG and what EGCG sources you could use. That's coming from actually Keith Barr. So if anybody's kind of read some literature in collagen and Achilles or tendon or ligaments, usually Keith Barr out of California is pretty much the guru in that area. He, besides track with Team USA, I work with sport climbing, and he's one of our advisors for sport climbing because of a lot of finger issues and so forth, and tendons and ligaments. And so I've been able to be lucky to be able to directly talk to Keith Barr. So I'll give you a little bit of insight on that combination right there. Vitamin C, magnesium, and then the nutrients with the asterisk, they're not maybe a direct role in the healing process or support to possibly building like the matrix, say for example for bone or for tendon and ligaments, but the omega-3s, the nitrates, and the creatine are very, very much excellent supporting roles. And you'll see that kind of with a lot of pretty much any type of injury. Those are going to be kind of my three key that I would use as a huge supporting role. So breaking them up to bone, and then I have connective tissue, and then I'll go through muscle and brain. So obviously there can be more, and sometimes obviously with you guys, you know how that works, is there's going to be sometimes more than just one injury at the time. But I just kind of broke them up in those chunks. I'm not going to go into great detail with the phases of healing. I mean, that's really your guys' wheelhouse. That's your experts in that. I just want to show that there is, based on that injury and the type of injury, that the metabolism and the nutrients change, whether it's causing a change in hormones, cortisol goes up. There's all kinds of a cascade of things that's happening. And nutrition, if it's not there, or if it changes, and they maybe back off, which is kind of common, right? They back off their calories. Well, I'm not working out as much, you know, all these things. I'm not realizing what the energy demand actually increased. So having to make sure that what they have done before, and maybe now they have to add things that they weren't doing before, but also make sure they're paying attention to their calorie intake and how those macros can change. So the injury does have an effect. So with the bone healing, it's around about a 15 to 30% energy demand. Obviously, it depends. Are we looking at a stress reaction? Are we looking at a full fracture? You know, what bones are included, those kind of things. But the acute, the first week, the body's not going to have a lot of oxygen to that area, and it's going to really go for the anaerobic metabolism. So it's basically going to use just glucose. So it's not going to go into using glycogen. It's also going to use amino acids. So making sure that their carb intake is good. So there are some things that the body does try to counter for that blood flow, and that's succinate and lactate levels. Actually, when they increase and they're going to that site for the fracture, they actually can draw in, and they're trying to draw in the blood flow and basically an angiogenesis. So they're wanting to make newer blood vessels. They're wanting to help. So that's a good thing. But succinate is an intermediate, metabolic intermediate that's part of the TCA cycle, if you remember that, for energy metabolism. So you need fuel. So for them to back off their calories and even back off carbs, and like, I'm just going to go all, you know, I know protein's really important for this injury or for any injury. Usually folks do pretty well on protein, but what they'll do is they'll back off maybe even the fats, but they'll back off the carbohydrates. Carbohydrates also, just to note, is they help control cortisol levels, and they also can help with the immune. So they are very important. Now, the types of carbs are going to be kind of a key as well, but we'll go more into that. And then you got the repair, the soft callus, the hard callus, a few changes you're starting to get when you're starting to really form. That's when your body's going to be kind of transitioned to that normal aerobic oxygen phos system. So it starts to transition to a little bit of a normal metabolism. And then the remodeling, just really making sure that through this whole process that the inflammation is being controlled as well. And that's really where the omega-3s are going to come in. And it's not solid to say, okay, you should have to day one start your omega-3s so you can start helping with that control. I really think there's something with that first week of some injuries that maybe not people start loading on the omega-3s, letting the body naturally do some inflammation there. But then maybe that first week that they actually really get going on a higher dose of omega-3s to be able to help control that inflammation, because you don't want to diminish it. There's actually a reason that it's there. So again, going through some of those key nutrients, that's kind of my roundabout figure for protein as 1.6 to 2.2. I would actually lean towards the higher, and then the calories being hypermetabolic. I didn't give like an exact amount because it's going to vary from the person, but just knowing if you can add, let's just say even across the board, if you didn't remember any numbers, is probably most injuries if they were to add 20% to their baseline of what they should have been getting in before, then you're probably going to cover your bases. Color. I am huge on color with my athletes, no matter whether it's an injury or not. And that basically can cover your carbohydrates as well. So your fruits and vegetables that are just all the, eat the rainbow kind of thing. All those are going to have your antioxidants, your anthocyanins, all the colors that are basically going to be anti-inflammatory. So purples, blues, all those. Tart cherry juice is a good one. I got my athletes to think of something different outside the box, and that's black rice. So they think that's really cool, and that's really high in anthocyanins. So things like that, just having them start thinking of really something very colorful in their plate. And then calcium, typically I say about a max of 1,500. We can go up to 2,000, but you want to divide those doses. What I have found in some of my, and it could be just coincidental, but a couple of my sacrum fracture, I was triathlete and then a mid-distance or longer distance runner, and with both sacrum fractures. And the thing that was, besides the fracture in common, is both having history as well of other fractures, but they are extremely high. They just, I think, automatically think, well, the more the better. And they were just taking extremely high levels of calcium. So something just to kind of note, like, yes, people think that's important, and they probably may have to supplement if they can't get all that from their diet, which is more ideal because you absorb that pretty much, I feel, a better system because you're getting all the other nutrients with it. But it is something to ask, and they're like, oh yeah, I'm taking calcium supplement, is, taking 6-8 Tums a day, not ideal. And anything in my world in nutrition, whether it's you're getting too little or too much, the body can compensate in not good ways, right? So does maybe, just question for everyone on here, does maybe having excess calcium like that when you're in the 5-6 grams, that's not evidence-based to take for bone health in the first place, is maybe that is actually over a long term could be actually worse and making things worse for the bones. So just a kind of a thought there. And then, like I said, vitamin D3 over vitamin D2. This is our levels that we look for when we look at bloods. is a serum between like 40 to 70. Usually our athletes, we just say a minimum of 40. Now on the essay in your reference range in labs, it can vary, but they're usually going to go down to like probably 30, maybe even 20 if they feel like that's your deficient level. But we kind of have a different lab system, and we usually say 40 for a minimum of their vitamin D. And that supplement can just kind of vary. How I recommend supplementation is if somebody comes in, let's say their serum level is a 20, and I want to get them to that minimum 40. For each 10 nanograms that I want to get them there, so we're looking at another 20 nanograms. Each 10 is about 1,000 IUs. So then I would say we got to get at least a minimum of 2,000 IUs a day to try to get us up to that 40 mark. Now you may have patients, I know I have some athletes that they're like, adding another supplement, and they can't remember. This is a nice one because vitamin D you can do weekly. So I'll have them, let's say they could do a 5,000 IU soft gel, and they could do 3 of those at the same time, and that will average my 2,000 for the week. So a lot of times I do that with my athletes. I say, okay, you're going to pick a day every Sunday at dinner. That's when you take your vitamin D, and you do it the next week. So that's a little trick that I can help some folks just remember, just do it once. Vitamin K2, that's kind of the range. There's different forms. There's MK4. Try to get MK7. I'm okay if it's a mix. I think that could be a good thing. So if you get something that's even K1, K2, or they have a K2 and it has both M4, MK4, MK7, just one's a shorter and one's a longer half-life. But that has been shown to help mainly when they're taking this calcium, they're taking their D, they're getting that in, everything's fine, but calcium needs to know where to go, and the K2 can help direct that. So that's where the key is. We in the US, probably everyone but Japan, probably doesn't get enough K2 in the diet. So usually that is something I'll look for to supplement. So I usually have like a good multi that will just have the K2 in it. So I'll always kind of lean towards that multi. But just something to think about if that hasn't come up before. K2 is kind of one of those underlying undervalued bone health, and that could continue. They don't have to take it just during the injury, just continue in that multi and give them support. Vitamin C, at least 100. You can go higher than that. That's no problem. And then the collagen, a lot of times we tend to think that for the ligaments and the tendons. I still think there's some benefit there for the bone. So I will recommend that anywhere from 10 to 20 grams. Magnesium, and then you got your supporting roles for omega-3s, nitrates, which is pretty much beet juice for the most part. It's easy. Spinach, arugula is in there too, but if you can just find, there's 2 brands of beet juice that I have my athletes get just locally, or we have some supplements that they can travel with, like powder, but or little shots called Beat It. But RW Nutson and Lakewood are really high in nitrates. I kind of geek out on nitrates, so I have a device where I can measure nitrates, and those 2 juices came in extremely high in how many milligrams of nitrates that I need, and for a vasodilation effect. And 3 to 4 ounces of each one of those, just pick your brand, whatever's on sale, is extremely high in nitrates. And then probiotics and creatine. The creatine is pretty much going to be on almost every injury type of protocol for me, because if they're immobile, they're not moving, we're going to be able to help maintain some lean mass. And then on the magnesium, I did want to note that talking to someone, making sure like, yeah, I'm taking magnesium, and they're taking mag oxide, it's kind of a waste in the sense if you really want to get it into the tissues, because mag ox is maybe 4% absorbed The rest of it's going to go through. So unless they're looking for, like if they're constipated, then maybe that would come in handy. So connective tissue, the tendons, ligaments, cartilage, again, just showing that the different phases of healing and how the body's going to respond. A lot of times, except for like bone or muscle, sorry, that you are going to go pretty much into glycolysis. So there's going to be a major glucose uptake. So having them, I'm not hungry, I don't want to eat, I'm depressed because now my knee got blown out and all these, it's like, okay, they don't feel like cooking, maybe they don't want to get up to cook, all these things is they really got to figure out whether it can be liquids, whether it can be Uber Eats, something to get their food, support people stopping in to drop foods off, bars, anything that they can get. They really need to go ahead and make sure that they're getting their nutrition in and not avoiding and minimizing their carbohydrates because they're not exercising as much. And then the key nutrients, I won't go through each one of these, but basically some of the change here is more of that importance for the collagen. And I think everyone's probably pretty much have read and understand that how that's a big piece now. And having it before that they're going to go and do rehab or any kind of movement, whether of that joint, of that injury, making sure that the collagen is in there about an hour before. So then those aminos like glycine and proline can already be digested in the bloodstream. And then the key is coming to get their rehab and making sure that that joint or that movement is happening. And so the blood flow gets there. This is where I feel what I'll do with my athletes is I'll have them mix the collagen with beet juice. The other thing, and if you have athletes or you have to like, I just don't like beet juice. Even this morning at track practice, I was passing out the beet juice, but I mixed it with blueberry juice and I mixed it with tart juice, and it's a whole new world. Like, oh, one girl came up 3 times, can I have more? So it does kind of decrease that earthiness taste of beet juice. So there's ways to kind of, and then you're getting the anti-inflammatory of the blueberries and the anthocyanins and the tart cherries, so it can be a win-win. But having those nitrates in there, and then about an hour is fine, and especially if it's high nitrate juice, then you're going to break that down into nitrites and then nitric oxide, and that's the goal, is to open up that blood flow, help that collagen get in. The vitamin C is great. I've had athletes also mix that with OJ, sorry, or they can take like a gummy. You do not have to have vitamin C and collagen at the same time that hour before. It is nice when you kind of just insurance policy, that that athlete did, or your patient did get the vitamin C in that day because they mixed it with OJ. So that's another option as well. But as long as the vitamin C is in your system, then it will be found and it will go to help with the matrix and the cross links with the collagen. Zinc, I'll just kind of make sure and kind of cover them in their basis of whether it be in a multi, and that's usually my default, so I know it's there. Same thing with copper. I just know it's in a good multi, but I will go through some foods with them and try to add those foods in there. Copper, cashews, having a trail mix, something like that would be easy. And then zinc, a little bit harder. Oysters are going to be the top choice, but I'll recommend, just grab a can of oysters and you can throw it in like a dish of some sort. So whether it's pasta or rice, or so pretty easy to make sure you get yours in. But the multi usually is my best bet because I just know my athletes will probably do that more than the oysters. Again, you're supporting roles. For muscle, this is where a little bit of change for the inflammation that's up to 5 days. It's actually going to favor aerobic glycolysis, What that basically means, it just means that there's going to be some oxygen available where it was not with the connective tissue or the bone. Still means that they need to make sure they're fueling and not ignoring those carbohydrates, and getting those good quality carbohydrates where it's a win-win for color as well. So sweet potatoes, the black rice, things like that. Excessive ROS, that's also where the omega-3s are going to come in. So if there's a reactive oxygen species, that's just inflammation that's going on, but we do want to kind of control that. So I would also recommend omega-3s during muscle injury. The basic key nutrients all going to be pretty similar. I'm going to focus more on the protein here. Leucine is going to be your magic amino acid that they'll want to try to get in every 3 to 4 hours for the day. If you're eating basically food, meat, just basically your normal protein sources, meat, seafood, dairy, you're going to get that leucine. Now, depends on the serving size, but if they do need additional assistance, if their appetite's not good or whatnot, then I'd probably recommend to go ahead and do either essential amino acids if they don't want anything like a chocolate or vanilla kind of mix. If they're not going to use their whey protein, essential amino acids, meaning you're getting all 9. I prefer that over just the branch chain amino acids. So there is some good research out of Arkansas and their protein lab that the EAAs can be a little bit more superior than doing the BCAAs. And you'll get your leucine, and that's basically like a very almost like a Kool-Aid drink versus if they don't want anything milky or too heavy, that works well. This is a direct at creatine for sure, for multiple reasons. 5 grams, it's usually 3 to 5 grams. I would lean towards 5 grams. You're going to be completely fine. They can mix that at any time of the day with anything that they want. There's no timing effect. I prefer creatine monohydrate, which is pretty much what you're going to find out there. A lot of the other creatines, there's some fancy ones out there and they're not any better. We don't even know if their absorption rate is even equal to creatine monohydrate, which is pretty much 99%. So that's the most researched, that's the safest one. That's the one that we always go with. Vitamin D3 again, vitamin C, and then of course the carbs. Here, because we're possibly in that area of the muscle injury, you're going to be losing some glycogen, so that's your stored carbohydrates in the muscle cell. That's going to be used up because it's locked, loaded, and used. So we need to make sure that we're getting that energy back. The carbs will also pull in some hydration. So for every basically glucose you're packaging into glycogen, you're getting 3 parts water. So it's a 1-to-3 ratio. So I have my athletes do that all the time, basically because of their exercise and contraction. Injury or not, those are 2 very good reasons to make sure that that muscle cell is basically hydrated as well. So my track athletes, obviously they're going to burn through their glycogen in their lower body faster. They cannot beg and borrow and steal from the glycogen they have in their tricep. So once this is gone in that muscle cell, it's gone. So just reminding them when they're injured to still be able to get those carbs in. Creatine will also pull hydration and pull water into the muscle cell, which is a very, very good thing. All right, brain injury, so concussions. Probably the biggest thing on here that we can discuss, and if any of my questions at the end, is creatine can be beyond muscle use. We're finding, military has done some studies, they've been doing some studies on this for a long time, but sleep deprivation, brain fog, brain injuries for concussion. So that's something that's getting a little bit more traction, is using creatine for the brain, and specifically for brain injury. So what they're finding though, it's just been really, really hard to measure it in the brain because you want to be alive. So they're obviously doing this a lot in the rats and mice and things, but It is safe, but they are going anywhere from 10 grams to 20 grams. And 20 grams seems to be the more common. I just have athletes break it up in case 20 grams at one time will basically could upset the stomach. And then once that happens, then they're kind of turned off. So I just have them break that up. And I believe the last protocol, and I'll confirm this, but Red Bull is one of their protocols for concussion is 20 grams. I had a discussion with one of our sports psych and with Team USA, and he also works with the Red Bull as a contractor, and we were discussing that, and I'm pretty sure they're using 20 grams of creatine for concussion. So, so something interesting to coming, I would say not new, but definitely coming into more practice now. Protein, calorie dense, we know any kind of brain injury or burn, that's always I learned that coming up from clinical in the hospital. Those are two major hypermetabolic conditions. Of course, these could be more mild brain injuries than severe, but keeping in mind the concussion athletes I've worked with a lot, especially in soccer, I feel like we had a lot more of those than we do like in track or climbing or other sports I work with. So is basically they feel nauseous, they're sleepy, they're tired, they're fatigued, they're fogged, they're not, they're just kind of out of it. Then they don't want to eat, so that was kind of our big thing, is making sure that they had meals, kind of setting them up, and made things really easy. So whatever support system that your patient or athletes have, I think this is really key, is to making sure that finding things that they like, smoothies, things like that, that they're just going to have to get in, because the metabolic just increases so much. Pretty much all the same, keeping them hydrated, their electrolytes, because there's going to be a cascade of the ions just get really wacky between the sodium and the potassium. Really kind of, there's an influx that goes back and forth. So there's a lot of cascade of events that with electrolytes in the brain that go on. So making sure that continues through the diet. Like I said, I mentioned the creatine, the B vitamins. Also will rely on a good multi, and I'll tell you my favorite multi at the end, but that kind of makes I just kind of can check the box. I'm still going to get them to try to eat, obviously, because we need the calories, but a lot of times I'll rely on just on a day-to-day thing if they can get that multi in. Omega-3s, I'm going to change that up for the brain injury, and I'm sure everyone's aware of that now, but just making sure that we're getting much higher doses of omega-3s, specifically EPA and DHA. So I'll have athletes say, well, I eat a lot of omega-3s. I have walnuts and I have flax, and I think that's amazing. Keep doing that. But that's ALA, and ALA of those omega-3s will not convert to EPA and DHA. It's maybe a 3 to 5% conversion. DHA is even going to be number one out of these two, but usually you're going to find them combined together. So I want those together. You're going to pretty much have to go supplementation. I will give them, obviously, especially omega-3s in the supplement form if they're like, I just don't like fish, I don't like seafood at all. But if I can get them to do salmon, if I can get them to do, one of my tricks is mackerel. So mackerel in a can. And if they like tuna fish, they'll like mackerel. It's, to me, less fishy tasting even than tuna fish. I don't even think tuna fish is that fishy. But if they get the boneless, skinless, it's in an olive oil base, it's actually pretty good. I've got a lot of athletes on that now, and especially if there's international travel, they'll bring that. So they got their protein and their omega-3s. So that's kind of one of our new secrets now that we've kind of really discovered, mackerel in a can. And you're looking at the same 3 ounces, comparing each one, salmon, tuna, and mackerel. Mackerel is going to give you 3 grams of omega-3s, and then salmon's 2 grams, and then tuna will be 1 gram. So of course you could have 3 times the tuna, you'll be fine. But so just let you know, it's pretty condensed amount. Magnesium, it can be definitely, if they're not getting in it through food, I'm gonna supplement. We have a powder, or Momentous is a brand that we'll usually go with for the pills. Zinc, vitamin D3, and then you're supporting. Curcumin being also very anti-inflammatory, so I might have them do like a shake with like pineapple, things very anti-inflammatory. We'll do like a tropical mango pineapple curcumin, so it just stays orange, and I'll have them mix that up. If we feel like we need to go much higher, obviously the seasoning you're not going to get as much, and then we use Thorn, and it has an excellent Marevia is what it's called. It has an excellent curcumin product. Right, the metabolic changes, we've kind of gone through these. This is kind of more of a summary here of some of the changes of the injuries. I think just also I've noted that obviously with the injury, they can have appetite change, whether it could be pain meds, it could be they're nauseous, it could be that they're just mad that they have an injury, they're depressed because they have an injury, because they're going to miss the key game, or there could be out. I have an athlete, my best long jumper, is out for the rest of the season. She today has her surgery. So it's it's a lot to process. So but a lot of those things, stress, a lot of those things can cause appetite change. And then the changes in the vitamin and mineral metabolism is making sure the fueling is there. Obviously, like I said, the color, I am going to rely on a multi at this point. And then what other supplementations that I might have to include in there. So if I can, like I said, using the food products, like I'll use Lifeway probiotics or kefir for probiotics. It's extremely high in a small amount, and it comes in all the different flavors. So it's kind of a liquid, right, yogurt drink. I can usually get them to drink that or add that to a smoothie. So there are ways I'll try to do it where I might not have to actually do a supplement. So assessing and monitoring, finding out their eating style. I'll do food logs. If there is anything, if they're coming in a deficit already, this is not going to help, obviously, their injury and the healing. So you're kind of not only helping them get through the fueling of injury, but even just getting them to baseline. So getting them to understand, like, we might be a little bit behind. We got to make sure that your fueling is pretty spot on for this injury. So getting a feel for that. REDS, there is that CAT tool. It's a screening tool, and I actually meant to send that, and I will send that to you, Michelle. It's if you guys don't already maybe have it, it's an Excel that we use, and we just go through the questions and what labs that we can usually input as well. So like an LDL or their lipid profile or their T3, we look at different things and kind of put that in there. Are they, if it's a female, are they still having their cycle? Is it irregular? All that stuff that goes with REDS. And I do have some slides in here about REDS because I'm pretty passionate about women's health, but also that, like, maybe could have that been a trigger to this injury, right? That happens a lot with our, like, my question, like the sacrum fractures, right? Or other fractures. And even though we're getting DEXs and they might not be optimal DEXs, but they're not showing, oh my gosh, this is going to happen, this fracture is going to happen, because then you have athletes on like weight load bearing type exercises. They're already in a good DEXA spot with their Z scores. So maybe they could be even worse if they weren't, having, other issues. So like, for example, like with REDS, we feel like that could be a trigger and kind of like a pre-issue that's happening that could have been part of the injury. So, so what their training load is, how their sleep, how their stress, I would say not a good combination is someone that is possibly at risk for REDS, and then they have a heavy training load. And those can go hand in hand, whether it's the athlete doing it or coach. So that I have a couple right now with that it's a lot of it is the training load. They're just overtrained. So education and nutrition knowledge, where is that athlete with that? Are they getting their information from their friend, from TikTok, and seeing what their knowledge is and kind of meet them where they are and just kind of help them along. So again, checking the carb intake, reminding that it does affect our immune support, our immune system, and it can manage cortisol levels. This in red is kind of more of a topic to discuss as a group, if we can, is the medications, possibly the dosing and how long is something, is that a detriment to healing? So obviously you need those at times, but when is that kind of like too much? And then that affects the remodeling of possibly repairing the injury. So just a question I threw out there. Also, if patients come in with a condition, obviously you saw that the glucose levels and glycolysis is kind of really, out of whack, then they're coming in and they already have diabetes or metabolic syndrome, their obesity, so they're already inflamed, aging, things like that. So making sure that they understand how really important nutrition is, having to step that up. Some monitoring tools, obviously you're going to check and, you'll know the athlete or the patient, is this something we're going to have to watch? Is body weight, composition, do you have access? Can they get a DEXA? Have they had DEXAs before? So we look at a lot of DEXAs. Girth measurements, when we're doing body composition through what we call ISIC, we're going to look at girth measurements. We did that in soccer. The trainers, athletic trainers, would always look at girth measurements with some injuries. The USGs, that's pretty much those P cups right there. We would test USGs. But also I tell my athletes, obviously they're going to have a device to do that, then just to check the color of their urine. Are they staying hydrated? And are we going for basically that lemonade color is what I tell my athletes to look for. And then the different biomarkers or labs that we're looking at. These are pretty typical for us to look at. Omega-3s, you can get a kit. So if someone is interested in where is their percent of omega-3s in their cell, that you can get a home kit. It's just a blood spot. I think we pay like $35 or $40. They're pretty reasonable. And then they'll get their results in about 2 weeks. Basically, it's like if they were doing a glucose, using like a finger stick, and then it's pretty easy. You put the blot and send it in. So Omega Quant is how we get our kits, and we'll do that. And of course, we're a team. So I just have my lens. I try to look through other lens and really just try to help each other out. And that's why I put this picture on here, is 2 of us trainers and 2 of us dietitians, and we team up and we're always helping each other. And that's even grocery shopping at Costco in Japan, and we have the best time. So we definitely try to team up. We're on trips and obviously communicate when we're not. So we usually have a variety of communication devices that we stay in touch, because with the Olympic athletes, a decentralized system, so we're all spread out. But we definitely help each other out. I just told one of our trainers this morning, I'm leaving the track and she's seeing another athlete that I'm working with. I said, hey, this is what she needs. Can you just basically be the cheerleader to make sure she's fueling? Ask her about her fueling. And so we kind of help each other out. REDS, again, my point here being it's, and I'm sure you guys are aware of this, that it can increase injury risk. So something just to think about and look into. The CAT2, this is how it's categorized. There is, and I'll send the link if you guys don't have it, is the Excel sheet that we go through. It's probably, you can Google it as well. but it just goes through like a question answer, and then it will kind of basically put that all together and give you a color and a severity of where you're at. And then the safety and plan, or strategy and plan, is personalize a plan. And that's really where get to know your athlete, know what they're like. They don't like fish. Okay, we're going to have to go with this, with the omega-3s, those kind of things. What kind of support they have, educating them. I try to come up, even with our Olympic athletes, keeping it simple. I think every athlete I work with, just keep it simple. Helping with, like, what are we going to do for meal prep? You know, if you, okay, you want to go to Chipotle, okay, Bole, just give them some options. It's okay to have healthy takeout, batch cook for the week, those type of things. And then supplementation, if that is something that's going to be needed, and a lot of times with injuries, we do a lot of supplementation. And with the Olympic world and pro athlete world, college, we need to make sure that it's third-party tested, so there are no banned substances. And I cut some logos here on the next slide to show the NSF, Informed Sport, Informed Choice. True Shield is new, so it is very, very legit. It's the same people that actually did the criteria for NSF. Her name's Lori. She's now with True Shield and has a criteria for banned substances. So here's just some of the go-to brands I put. Some of the other brands I go to. I like Heart and Soil for the bone matrix. Sometimes Juven can fit. Beat Elite, Vital Proteins for collagen. That was our other group picture I had on there with ATs that I work with. Supplements, pro Olympic level, there are direct websites that people can go to. I kind of just have some certain brands I really like, but having, if this is the case, having another set of eyes to look at if it is certified, and does it have a particular logo. It needs to have that logo on the container, on the bottle. Because there are people out there that say third-party tested, or it will say NSF, but it's not for certified for sport. They're just audited at their facility or their factory, which is great for cleanliness. There's no rat poo-poo, you know, that kind of stuff that they're audited for, but they're not doing the banned substance checking. So some of these you have to kind of look. There are apps. NSF has an app, and so does Informed Sport. Informed Choice, the same company. You just have to actually go to the website to look. So, and some of those suggestions I've already talked about. I just put them all together. Something different, new, like the black rice. A non-dairy milk is Ripple. I'll recommend that a lot. If they're not a dairy person. I'm big on the Lifeway kefir, the beet juice. Yeah, so it's just kind of finding maybe outside the normal foods to be able to get in the mackerel, things like that. So, and then these slides are going to be, I'm going to leave these here, but they're just the red flags for reds. I'm sure you guys are very familiar with. And this last slide is basically showing some data that we have from our para and Olympic sports, and basically the prevalence of LAE, which is your not getting enough calories in, low energy availability, and eating disorder risk in elite athlete populations. So, and I believe that is it. So.
All right, so the first question comes from Rachel, and as always, a fantastic presentation. So really appreciate that. The first question here comes from Rachel. Not sure how much this is in your wheelhouse. How much can this information be applied for non-athletes, like construction workers with joint pain or perimenopausal women? So starting there. So how about in the non-athletes?
Yeah, it definitely the same. I think in that population, they're probably not going to be as well aware of supplementation. So that might be something new for them. Then I'd probably triage what is the most important, and then getting like your omega-3s, so they're not bombarded with supplements, right? But get your omega-3s, get most that you can from food, and have them understand why. But yeah, it can definitely be used. And also creatine, I'd probably in like postmenopausal, vegan, elderly, absolutely, because then you have a population that's probably not getting enough from their diet from meat, because in general you'd have to eat like 5 pounds of meat a day anyways, but they're probably even lower and not getting the normal 1 gram that we get from the diet. So that population, I would even say, hey, it's safe, we can do it. Maybe the rule of thumb for or contraindication would be if there was kidney issues, and yeah, would not do creatine or a high level of protein.
And then to piggyback, how much does hormonal changes make a difference?
With injury?
Correct.
Yeah. I think that's a good question. Yeah, they say, and you guys, this is probably more your wheelhouse, but is it how females land versus men? Would females I'm thinking soccer, right? More ACLs. I don't know. I can say now, kind of removing myself from soccer and just saying track. Our biggest thing is soft tissue, so muscle, right, is the biggest thing. Strains, quads, hamstrings, all that. I feel like it's pretty even between the men and the women. So I don't see it as different. Now, as far as like we go in, of course, there's our young athletes, but I don't know to answer, like if I hear that could be a thing, you get more lax, right? So I don't know. I'm gonna probably bounce that back to you guys. That's your wheelhouse, but.
The next question comes from Brittany. Thank you for this presentation. The content was very informative and useful. What have you been finding in the last couple of years is one of the most common deficiencies amongst athletes in general? Is it, well, we'll start there.
I would say ferritin. I think if people generally do we always do CBC and as well, but we do an iron panel with it. So obviously looking at one marker doesn't tell you everything. So I would say by looking at the iron panel in the CBC, ferritin still falls in there, and we could have everything else in a good spot. But we can have a ferritin, in the teens or single digits, and everything else can look okay. So I would say that's probably the most common thing that we have. I would say something, if you would ask me 5 years ago, it was magnesium red blood cell. We pull that on every athlete as well. And if you look at the stats, you look at like the research, 75% of people don't get their magnesium in the diet. And then you have, because it's a huge factor for so many enzymatic, reactions. And so it's very important. And then with muscle contraction, because you have the calcium and then the magnesium relaxes. So I'm like, gosh, we probably are low, right? Our athletes. And then I've seen the last 4 years so many magnesium red blood cells, and I've maybe 3% are low. So that's something worth thinking about, just pulling out and putting it into more advanced. So on the opposite side, the one thing I thought I would find, we're going to revisit. We have not really seen, it doesn't mean that they should still get it in their diet, and I still may supplement at times if I can't figure out their muscle cramping going on. I've gone through everything. I'm going to add mag, but I probably won't do blood on them. Yeah.
And then for the ferritin, is it the same for males and females? Or do you find that there's potentially a different deficiency that's more common in the other gender?
Ferritin, mostly if I was to pick between male and female, it's more female. And then if I was to pick, obviously, different disciplines that I work with within track would be your distance runners, right? But that's not always the case, but that's typically common. They're also pretty good about doing their iron supplement. So I would say women more, and then more of my endurance athletes, but not always. I have some low track, and we do IV iron because we cannot get it up. In the multiple tricks that we try, we can't do it. So we'll go to IV.
And so with, kind of adding to what you're talking about, what is your initial recommendation for supplementation or diet implementation for the ferritin deficiency?
Obviously, I'll go through and see what foods are they actually, getting those in. A lot of times, I'd say for the most time they are. Then my first course is we use ferritin or use iron bliss glycinate, so a chelated. It's not always my go-to, but for the most part, that's what I'll use. Thorne is kind of a normal or a clean athlete brand. I've also had very much success with, if they're already and they're used to, or they're getting it from their college or is nature made. So I'm okay with that one. And that's a ferrous sulfate, and at 65 milligrams. And sometimes we'll use that. So those are kind of what I'll go. The bliss glycinate is just usually a little easier on the stomach and constipation issues, but usually that's what I'll do. And then just making sure that I may switch them if they're if I can't get their ferritin up, and we'll recheck them in 3 months and we're not really budging, and they're pretty diligent about taking it. Especially if we're doing 25 milligrams. I may then change them to the sulfate and just change the forms. I also may change the timing that they have it during the day. So we try all these different things, and then if that doesn't work, we'll go to the IV infusion. There is some data out there. I am not convinced, and part of it is just because I know my athletes won't adhere very well to it, is doing iron every other day. And there is a little bit to that, but not enough, I feel, to say, oh, that is the answer for the ones that you're challenged, because my athletes, people are like, what day is it? Let alone, did I take it yesterday? I got to take it tomorrow. So life doesn't really help that routine. So I usually don't do that.
And then Sydney was asking to say again your favorite juice that had nitrates.
That is Lakewood and RW Nutson. So pretty popular. I haven't tested I think Publix might. There was one the other day. There was Publix, so I need to test. But those two for sure I've already tested, and they're extremely high in nitrates. Some of the beet juice extract products that are out there is just that when it says beet juice extract, it's the actual amount of nitrates in it. You won't be able to tell, and it's slim, like very, very little. You're not going to get around that 400 milligram. It may be 3% of that extract. So you're getting very little of the nitrates. We also use Beet Elite, which is a powder form, if people just don't want to have the juice. But yeah, and I don't know if I mentioned my favorite multi, and I don't get paid by any of these, but I just know when I'm doing, like when I'm talking to people, like, just give me, all your experience, all you're not, you just tell me which one, or tell me 2 or 3, right? So it's Thorne Multi Basics. It's called 2 a day, and it's certified, so I don't have to worry about that. But I just tell my athletes take 1. They don't even have to take 2. It is so loaded, and it's got my zinc, it's got everything I need. There's no iron and calcium in it, which I actually like, because then I can try to get that from food, or maybe they don't need iron at all in a supplement, you know, or even the calcium. So I like that those two are actually removed, because you can individualize that. But that way you can use it for men, women, it doesn't matter. So that's my go-to for a multi.
Then as we're wrapping up, so I can already see that quite a few of the people who are attending from across the country. If people are looking for, and we had talked about this a little bit before you started, if people are looking for local sports dietitians and sports nutritionists, have they gotten more organized now in having, like, here's a pool, here's a website, they're all going to be certified through this body?
I would go through, it's called, they just changed the acronyms too long ago. It was CPSDA, but it's ASP for American Sports Performance. It's crazy because I'm speaking two things at their conference next week, but they've changed. It used to be CPSDA. That's all I can remember, but that is a subset, and it's all either sports dietitians or tactical. So they're working in the military, or college or pro teams or anything. But I can send you that link. But it's basically ASPDA is the acronym, and then put sports nutrition, and that should pop up. And that to me is the organization to kind of go to see anyone in that area. And if someone is not finding that, or you're looking, I'm open to email me. I'll get you the right information to look, because it's it can be challenging. The American Dietetic Association also is one option, but it's going to be a mass quantity of people, so you're going to be kind of filtering through clinical and bariatric, and it's going to be a lot. So if you want more active population, that would be good. So, yeah.
Well, thank you so much for what a great talk. Certainly right on right what we were looking for sure.
Awesome.
Great to reconnect again. I hope everything's going well.
Yeah.
All right, and then thank you to everyone for attending. We look forward to seeing you again soon.
All right.
All right, I hope everyone has a nice night.
All right. Bye.
Bye.
Bye, Michelle.